Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, joined once more by my older, ever getting closer to 50 years old.
Well, brother, by the time this plays, I will have crossed that
You think
threshold.
so?
Yeah, because
I might play this. I might edit this and release it before your birthday. So
I'm the one who downloads the audio.
So
you won't have it.
You don't want birthday cards from our listeners in Greece? They might send you something cool.
Ooh,
I know.
the Greek. Yes. Send me some Greek food. Whoever it is in Greece that's listening to us, there's like 3 of you because we're in the. We're like that's number 34. It doesn't take many.
Okay.
But sure. Absolutely. 3907 Richard Reeves Drive, Murfreesboro, Tennessee, 37127. You can send your birthday wishes
to Steven, or you can just. Actually, the biggest birthday gift is to just share this podcast with a friend.
Yes, give us a 5-star rating.
That's right.
And
click subscribe or follow. That's right. All the things. Well, we are happy to have back Dr. Christine Garrett. She's a professional services veterinarian with Antech Diagnostics, which is the lab service that we use for our send out blood work. We talked the last time that you were here, Dr. Garrett, about preventive medicine.
Still can't say it right, can you?
Just debate which way to call. Go back and listen to that whole debacle in the last podcast episode. Well, however many it was ago. But at any rate, we're here to talk today. You mentioned as a part of the episode about preventive care that your veterinarian would be checking for early signs of diseases. And we mentioned a disease in there, chronic kidney disease. And we asked you to come back to talk to us today about chronic kidney disease because it is something that we see often here at the vet office in both dogs and cats. And we'll talk a little bit more about who's more susceptible to that. But Dr. Garrett, welcome back to the Family Pet Podcast.
Thanks for having me. I hope that you release this on Steven's birthday.
On his birthday? Maybe we will.
There's an idea.
Okay. Before explaining chronic kidney disease, I need some help in understanding
anatomy,
physiology. What does the kidney, or there's 2, what do our kidneys do for us? But I guess more importantly, what do they do for our pets?
Yeah. Generally speaking, and this could apply to people too, the kidneys are kind of like a filter. So they're going to filter some waste out, aka going out as urine, and then they're going to keep some good things in. Helps with like electrolyte balance, so like salt balance basically. But they also have some other responsibilities too. So they help with blood pressure regulation and actually the production of red blood cells. So they're pretty important. Maybe that's why there's 2 of them. They have, we need our kidneys to do a lot of different things.
Did you say that the kidneys produce red blood cells?
They can help produce red blood cells.
I was confused there for a minute.
So the actual production doesn't happen in the kidneys,
but
there's this whole cascade of signals that happen in the body to say, hey, we need more red blood cells, and the kidneys are actually part of that. It's a kind of a unique thing. A lot of the other organs have more, narrow specific jobs, but the kidneys are involved in a lot. But their primary job is to act as kind of a filter. So production of urine, retention of some of those things that are good for our bodies, like water. They help prevent dehydration. So yeah, they got a lot of jobs.
All right. So they pull out the toxins and then we get rid of that through our pets. I keep talking like it's us, but it's
also
the functions are the same.
Yeah.
Yep.
So they then expel that through the urine, but then it helps balance the electrolytes. Walk me through that part. I always there's a certain sports drink that always tells me when I'm exercising that this is important for my electrolytes, but I don't know.
So
it just tastes good.
Basically, the kidneys, like I said, are a filter. So within that larger filter, there is a thing called a glomerulus. And without getting too terribly detailed, it's kind of like
I think that fun fact is that word. What was that word again?
Glomerulus.
Glomerulus. Yeah.
Glomerulus.
Yeah,
okay.
Glomerulus. Preventative.
So, now we have 2 words to mess up. Okay.
Depending on who you ask. But Yeah, so there's this thing called a loop of Henle within the glomerulus. There are all kinds of these like very detailed things anatomically that are happening on a very small scale to help things like your potassium, sodium, chloride, help with some of the regulation of those things too.
I like it. I feel informed and educated.
All I feel is that I feel like I know even less than I thought I did.
Well, yes, I feel very.
Let's talk about it some more.
Yeah, let's.
There is a lot to know.
Why do kidneys hurt when you get punched in them? That's what I want to know.
They're very sensitive.
Steven used to beat me up a lot growing up.
And, oh my gosh.
To be fair, I only hit you once in our entire childhood. There was one time I remember.
Remember that time we tried to stay on track?
Yeah, right.
This is definitely not that track.
Not this podcast episode.
Remember that time you punched me in 7th grade? Yeah. I want to talk about it now.
Does it hurt?
Now I have a podcast, international platform.
That's right.
My brother punched me.
All right, so we've talked about the kidneys and their function. What is chronic kidney disease in our pets? What does it mean if your doctor does some of the diagnostics and says, I believe that your cat has chronic kidney disease?
So we're typically going to be thinking about irreversible loss of function within that kidney.
Okay.
And you mentioned diagnostics. So there are a lot of things that go into diagnosing chronic kidney disease. It can be rather complex, but things like your physical exam, blood work, urinalysis, looking at multiple parameters, even imaging of the kidneys, ultrasound, x-rays, doing those kind of things so that we can determine, hey, is this a kidney problem or is this something that's happening outside the kidney that's making the kidneys angry? And is it something we expect to be able to help this pet recover from, or is it going to be a chronic issue? There are acute kidney injuries, and then there's chronic kidney disease, which we think of, like I said, as a more prolonged disease process. And we've actually lost function there. So the kidneys can't do the job that they were once assigned to do.
And what is it that makes it irreversible?
So once we have loss of function in the kidneys, they're not going to regenerate. Like, if you cut your hair and it regrows, cool. You can regrow your beard if you shave it off. Your liver has a great regenerative capacity too. So those are like things and organs that have a regenerative capacity or can kind of recover function and recover from injury a bit better. The kidneys don't really have that reserve capacity as much. Again, we have 2 of them, so that's great. But if there's loss of glomerular function, filtration apparatus is injured or disabled, then there are some cases where we're not able to regain that. If it's something acute or temporary, like a toxic insult or something like that, sometimes we can give those kidneys some time to recover, but it doesn't always happen.
I don't remember if it was on a podcast that we did or if it was in one of our doctor meetings or a lunch and learn that we had, but I seem to remember someone telling us that many cats don't show signs of kidney disease until they've lost a significant function of their kidneys. Am I remembering that correctly?
That is correct. Yeah. So the cat doesn't know that they're ill necessarily if they lose a little bit of kidney function. It's even difficult to pick up on some of our diagnostics. Sometimes we have to lose a substantial amount of kidney function before a pet either has clinical signs or our lab work changes are notable. Now, we are improving our diagnostics for kidney disease all the time to help with that. So helping pick up on things sooner, and also just talking to pet parents about things their pets might be predisposed to, like kidney disease, and the signs to watch out for.
So we talked about what the kidneys do, and if they stop filtering, if they stop balancing, or to an extent, they're doing it less. What is that doing to the pet when you talk about symptoms, signs or symptoms? Yeah. What's going on inside our pet?
So one of the big ones that we see is dehydration. So a pet is not able to maintain that fluid balance in their body like they should be. So they're peeing out more water, which means they have to drink more. So one of the first things that an owner might notice is the water bowl is always dry, or their pet is seeking out other water sources. Also, they might be urinating more. So think about a cat's litter box. They're used to scooping it a couple times a day. Wow, now these spots are getting bigger. Wow, now I'm having to change the litter box more frequently. So dehydration is one of the things that kind of happens when the kidneys can't maintain that water balance like they should. And that's one of the things that owners will notice. Also, things like vomiting, inappetence, kidneys maintaining that balance in the body of those waste products. Some of them can actually cause a pet to be nauseated, which then leads to them not wanting to eat. So weight loss, nausea, vomiting, those kind of things can all pop up. But usually that's once the kidney disease has progressed a bit.
So when the pet parents start seeing these signs and they call the veterinarian says, come on in because we need to put hands on this cat or on this dog. You mentioned ultrasound, you mentioned x-rays. Are there other diagnostic, how are they in the clinic finding the problem?
Yeah, so every visit's pretty much going to start with a physical exam. So we're looking at that pet, nose to tail, and kidneys, because they're responsible for a lot of different things in the body. I don't think I even mentioned blood pressure earlier. Maybe I did, but things like hypertension can happen as a result of kidney disease too. So they're looking at their retinas, making sure their eyes are okay. They haven't had a problem as a result of their blood pressure. Maybe even checking the blood pressure. Checking for dehydration with a skin tint. So is their skin going to stand up and kind of like make this little tent shape? There's a lot of different ways to check hydration, but that's one of them. Are their gums really tacky and dry? Have they lost weight when we put them on the scale? Those are a couple of things. But then also diagnostics. So when we're looking at a pet's health history, what preventive care have they had in the past? Do we have lab work from, let's say, 6 months or a year ago to compare to now when this patient is ill? So, and how is that changing? Are our kidney markers, were they normal 6 months ago and now they're abnormal? What about our urinalysis? So the urine, because it's produced by the kidneys, gives us a lot of indicators when the kidneys might not be working appropriately. So
and diagnostics would help us really, like, is that going to give us the earliest signs? Would be the diagnostic tests that the veterinarian are going to run?
Yeah, so because the kidneys, you have to lose a substantial amount of function for clinical signs to show up. So clinical signs would just be something that the veterinarian or pet owner might notice at home or on physical exam. Before that happens, our blood work, or even sometimes imaging, ultrasound, x-rays, those modalities can actually pick up on slighter changes. And that's one of the reasons why I mentioned, hey, what's your health history look like? What are our values looking like from last year, and how are they trending? Are we going in a direction that suggests we might have a patient that has early kidney disease? And what can we do about it now versus, hey, my cat is drinking more, peeing more, not wanting to eat. What's going on? And we've got a patient that is in stage 3 or 4 kidney disease. We stage kidney disease too.
So I just want to go back a second.
You like to go back a lot.
I do like to go back because things,
okay.
because things our guests say really catch my attention. And this has nothing to do with chronic kidney disease necessarily. But you talked about
Going
the
back to our
fact.
childhood again.
No, not that there.
When did he punch you back?
That's right.
No, he never hit me because he was weak. He was little. Our veterinarian, by looking at a pet's eye, can diagnose things in a kidney, or by looking at the skin. I'm just amazed at how talented. I'm not a medical professional. I'm amazed at how talented and skilled and adept a veterinarian is in examining and diagnosing problems in a patient that can't talk to them.
Right.
I kudos.
Good job.
Cool. It's a pretty cool thing. So like the eye specifically, if a patient has hypertension, the retina can actually show signs of hypertension or detachment even in severe cases. So there are just these little factors that we might take from a physical exam or from the history from the pet parent and put those all together to form a, hey, this all fits together in our diagnosis of chronic kidney disease.
Because hypertension could be caused. Yeah, it could be caused by other things, but when you put it together with frequent urination or all these other
and the skin
together, the skin tinting and all that. We've talked a lot about cats so far in this episode. Is this something that can also affect our dogs?
Absolutely. Cats are going to be the predisposed of the two. The prevalence will be higher in cats, but certainly dogs can have this issue as well.
And the signs are the same or similar? Obviously, they're not using a litter box, but
Yeah, they would be similar. Now, dogs typically are going to, I don't want to say be more vocal about their clinical signs, but sometimes pet owners will notice more often. So, like, let's say a dog normally doesn't ever have any accidents in the house, and now they're having multiple urinary accidents in the house. That's going to be an indicator to that pet parent that they need to call the veterinarian. Whereas a cat that already uses a litter box is still using the litter box might take a bit longer to notice that particular
And
change.
the diagnostics are the same for both as well, dogs
Yeah,
and
they would be
cats.
very
Okay.
similar. Mhm.
All right.
So we talked a little bit about signs and symptoms of seeing it as it develops. Are there things that, if I want to get back before that, even if I want to understand and help be prepared, are there predispositions, or are there
Talking
conditions,
about like
or
breeds that are more
well, breeds,
predisposed?
but also is it an overweight dog is more at risk?
Okay.
Is it a
Yeah.
senior pet that's more? What are the other factors that cause risk factors, I guess?
Well, if you want to talk about just dogs and cats, being a cat, there's your risk factor. So cats.
Poor
There
Fezzik.
are certain breeds that are predisposed to things like polycystic kidney disease, some congenital conditions that can happen, things that your veterinarian might be able to pick up on. Like, let's say your cat only has one kidney. I remember doing a physical exam on a kitten, only one kidney in that kitten. So that's going to be a factor that maybe predisposes that cat to kidney disease if they only have one of them. And so there's a couple of things there, but like you mentioned, breeds are definitely a predisposing factor. Cats, the opportunity for them to have chronic kidney disease just goes up over time. So exponentially, cats that are geriatric are going to be the ones that come in with chronic kidney disease more so than like your young patients. Those are going to be more congenital cases, toxin exposure, that kind of thing. Chronic dehydration that can damage the kidneys and have it be an actual chronic thing for them too. But I think a lot about toxins as well, especially in dogs.
Let's move into prevention and treatments. I don't know which one you would rather talk about first, but what can we do for prevention and or treatment?
Well, we always want to prevent things. So let's start with prevention.
Okay.
Knowing if your breed or your pet is predisposed to kidney disease. So talk to your veterinarian, make sure that you understand, like, hey, this dog or this cat, they have a predisposition for kidney disease. If it's a cat, yes, potentially. Maintaining hydration, especially for our kitty patients. They're not great drinkers. Things like canned food. Some veterinarians will recommend a canned food diet for patients that have kidney disease or are predisposed to it to increase their fluid intake, that water intake overall. Other things preventatively, don't leave things out that your dog or cat could get into, please, 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 that are toxic. So things like lilies, your antifreeze for dogs. There are a lot of different things in our households that we don't necessarily think about as being toxic or dangerous to our pets. But if you have a pet, it's worth kind of going through those lists of common toxins. Like I said, lilies, antifreeze, probably your top ones for cats and dogs respectively.
Does
Sure
that go back to what you talked about before of when we've damaged the kidney, they can't regenerate? So if a toxin's introduced, that kidney is working really hard and it might even hurt itself or become damaged.
Yeah, so the different toxins work in different ways. So different toxic principles or methods that they damage the kidneys, but some of that function might not be. They might not be able to recover from that loss of function. Unfortunately, we do see cases where if the toxin exposure is severe enough or prolonged enough, that pet might not recover from that. So that's a very, very sad situation and one that I always hate to hear about or find pet parents in.
And then you talked about food
for prevention.
Well, and also I guess treatment.
Okay.
Is that so? When you focus about treatment, what are the things that people might expect?
Yeah, treatment. One of the first things that we'll typically do is talk about dietary ways to manage this. We talked earlier about the kidneys and what their function is. So if we can help them perform their duties or their function, things like phosphorus We can restrict phosphorus in diets, and that can help the kidneys. We can increase their water intake either through a canned food diet or just having better access to water, flavored waters. Those kinds of things can all be considered helpful as part of nutritional management for pets with chronic kidney disease. But other treatment modalities are going to be things like actual fluid therapy. That can be under the skin. We have patients that will come in for subcutaneous fluid therapy. That just means you take a bag of fluids and you give a little bit to the pet under the skin a couple times a week usually. Works great for dogs and cats. Owners can learn to do it at home even, and that can help.
I've done that before. Anybody can do it.
If Steven can do it, anybody can do it. Yeah.
There you go. So it can really help prolong the health of the kidney function that's there. So if we lose kidney function, we want to maintain and help what is remaining function for as long as possible. So fluid therapy is really helpful. We'll be doing things like checking blood pressure, as I mentioned earlier. If there's an issue there, maybe a medication for that. Other treatments, if you're talking about pets in very late stage kidney disease, it might include something like a referral to a specialty hospital, depending on the cause, for dialysis. And occasionally we'll have a patient that actually has a kidney transplant. That's very
I was going to ask about kidney transplants.
Yeah.
Okay.
Here's a not, I know it's not time for a fun fact yet, but at some of the referral hospitals, if you have a cat that has a kidney transplant, the donor cat is usually a shelter or rescue cat. And so if that cat is kind enough and matches with your cat to donate the kidney, then you have to take home 2 cats.
Hey, that makes sense, man.
Hey,
yeah.
It's worth it.
And they also recommend doing a dental cleaning prior to things like that, because that oral care is very important. Decreasing that bacterial load, making sure that pet is as healthy as possible before they go undergo a significant procedure like that.
This is a random thought that if their bacteria is in the mouth, they swallow it, it gets into their digestive system. Is that going to be filtered through the kidneys as well? That bacteria?
So not necessarily bacteria that's swallowed, because think about our pets licking their feet, things like that. This would be more exposure through like the gingiva. So if they have bacterial that's going directly into the bloodstream in their mouth, that kind of circulating bacteria that can lead to things like endocarditis. So it like lands on the little valve leaflets potentially. There's some discussion about how much that actually happens. But then certainly the kidneys are filtering blood to make urine. And yeah, that could be a significant issue.
If we've got a pet who has been diagnosed with chronic kidney disease, we talked about some of the treatment options. What is the life expectancy? What's the quality of life for a pet once diagnosed?
So it's going to be variable. I wish I could give you, hey, if your pet has stage 1, 2, 3, or 4 kidney disease, they're going to live X number of years. I wish that I could give that kind of like peace of mind to owners. But the reality is that it's going to be very dependent on the cause of kidney disease. If it's a progressive thing, or if let's say they have that toxin exposure. That toxin exposure hopefully will never happen again. So they'll be able to maintain their kidney function as it stands. But if that cat already had a predisposition for kidney disease, that function is going to deteriorate over time anyway. So that patient would have a poorer prognosis than, say, one who just has kidney disease. They never have a toxin exposure, and there's nothing necessarily to make it progressive or progress more quickly. So it also gets back into treatment. How aggressive are we able to be with our treatment options? Will that patient accept a dietary change? Will the owner be able to give fluid therapy? Can we get weight back on that scrawny little cat that's had kidney disease and we didn't know it and they've lost weight now? So I didn't mention earlier, but things like appetite stimulants and anti-nausea medications can be very helpful for these patients just to make them feel better and increase that quality of life over time. So I have patients that go on for years with kidney disease. And those are usually the ones that are having a dietary change, maybe doing some fluid therapy. And it's a slowly progressive thing. So having chronic kidney disease isn't the end of the world. It's going to happen to our patients. Early diagnosis and really good management can help extend that pet's quality of life and their lifespan.
So all is not hopeless. You can have a good years of quality life.
Yeah,
if
years.
you're
That's probably
years.
what pet owners want to hear. Years.
Years.
Yeah.
It can
We
be
like that. Years.
Yeah. Worth doing the diagnostics and worth investing in that patient's health, and figuring out how best to manage that case.
Great. Well, that's. Is there anything that we should have asked you about chronic kidney disease that we did not?
Oh my gosh. Well, now I can't think of anything. Y'all were so
Right.
thorough.
We did it.
Great job.
I have to compliment you on
CKD.
your ability to hang in there with us with video. Most of our you're the first guest that's had to been distracted by not our handsomeness but our ridiculousness.
Ridiculousness is absolutely it.
So thanks for keeping us on track today. Staying on track, and it's time in our show that we ask you to bring us another fun fact. You gave us a bonus one earlier.
But it's the second.
I'm not going to try to pronounce that word again. But,
so this one is also winter themed.
Okay.
So I want to keep on track. Again, we're all trying to stay on track. But this one also has to do with like salt balance. So we're talking about CKD and the things that the kidneys are responsible for. One cool thing that's not about dogs or cats is about penguins. Penguins will actually like sneeze kind of salt out of a gland in their nose to help with their salt regulation too, because they're in salt water all the time, so they actually have to expel that salt from their bodies. So if you ever see a penguin sneeze, it's actually expelling salt.
Snot rockets made of salt.
Salt rockets.
Salt rockets.
Salt rockets.
Yeah.
All right.
So
Awesome.
penguins get salt. Perfect. Fun fact. Go tell your friends.
Is that all the different types of penguins? Did you know that penguins and polar bears never meet in real life?
Right. North polar bears, South penguins.
That's right. There you go. Another bonus fun fact in case you didn't know that. That's pretty basic one.
Stephen needs to actually put the video of a penguin into the podcast, please.
You have to find this.
I figured out a way to do this.
Yeah.
We've got to do this.
Well, Dr. Christine Garrett, thank you so much for joining us on this episode of the Family Pet Podcast to talk about chronic kidney disease of our pets. Thank you. I learned a lot, and so I know that our listeners did as well. We hope that you all have enjoyed this episode of the Family Pet Podcast. We would appreciate it if you would share this with a friend.
Give us 5 stars.
I don't care how many stars you get. Just share it.
Don't say that, because I had a friend who's like, it won't let me give you 5. I give you 4. It's like,
I'll take it. Well, that's right. Well, we appreciate it. Be sure, again, to look for us on YouTube as well. Just search for Family Pet Podcast, and it should pull up. But until next time, stay curious.
To the family.
Okay, I'm just kidding.
oh,
That'll be on the edit.
that's going to be on the edit.
All right. Here we go.